When we think about assessment, a lot of things can come to mind. So we want to put ourselves into context a bit when we're connecting it to unit planning and connecting it to the work of helping students improve their performance. So assessments, in terms of unit planning, are nouns. I don't want to come up with a new verb from the skill. I want to have a direct alignment to the skill. So for example, if I said the students had to list the characteristics of a cell, then I would go down into assessment and I would expect to see a list. And if I say that the students had to compare and contrast the plant cells and animal cells, then when I go down to the assessment box in the unit plan, I would expect to see maybe a Venn diagram or a T-chart, but a comparison. So there's a tight alignment between the skills and assessment. But what is the point of the assessment? What is its fundamental purpose? The assessment is evidence. It's evidence of the curriculum. I'm not really worried about grading at this point. I'm not worried about weighting things or having it be something that produces something for a report card. I want evidence of the curriculum. It comes in two forms, either a tangible product or a performance, an observable performance. So it might be something where the child performs a speech on a stage, or it might be an essay, or it might be a bench they built. So in this sense, the first thing we think about is it a tangible product or a performance that's going to be the evidence of the skills and the thinking, maybe an essential question, in the curriculum. The point of assessment in this work is to provide feedback to the learner. The truth is, a teacher cannot improve a student's performance. Have you ever tried to force a child to learn something? It's an awkward experience for you and for them. The only one who can actually improve their performance is the learner, the student. So teaching is an invitational art, and assessment is the way that we give feedback to the learner so that they have enough information to actually improve their performance. When we think about assessment as feedback for the learner, it challenges our thinking about what we're doing in terms of standardized testing. And I'd like to talk about that a little bit. With standardized testing, it's important information, but it's not information designed to give feedback the way the assessments in a unit plan do. Standardized testing is very effective for giving faculty an idea about their program. And if you read the actual introductions to standardized tests, that's what they say they're for. So it's really in society and in our profession that we have started to commit malpractice with standardized test data. And that's something for us to challenge. So an analogy we use is the idea of, let's say, the medical field. When I go to a doctor, one of the first things a doctor might do is take my temperature. It's important information. An elevated temperature can correlate to a lot of different things that my doctor would want to start giving me a prescription for. So if I go to my doctor and I have an elevated temperature, he's going to ask some questions. They might say, well, are you experiencing flu-like symptoms? If yes, now the prescription is clear. If no, I need to do more tests and find out more information. If I have an elevated temperature and I don't have flu-like symptoms, well, that can correlate to an active tumor growth. So my doctor might say, you know what, I want to go for an MRI. Okay, that's additional information so that they can get a diagnosis and then give me a prescription. I wouldn't feel comfortable going to a doctor who says, you know what, taking your temperature is an easy, inexpensive test. So I'd like to take your temperature. You have an elevated temperature. You're not having flu symptoms. MRIs are expensive and take a lot of time. You know what? I'd like to start chemo on Thursday. I would feel really uncomfortable with that kind of a knee-jerk response to the temperature data. Similarly, I wouldn't want to go to a doctor who says, you know what, temperatures are overrated, everyone's taking them, I have no faith in them, they're very limited in terms of their data, so I don't take temperatures anymore. I would really like you to take my temperature because it's going to guide you to information or to additional questions that you might want to explore. In this way, standardized tests for education are like a doctor taking your temperature. It gives me an initial gauge so that I can either decide I need to look more at what's going on with this population or with this student, I need more information, or everything seems to be okay and normal in terms of that area. It's only when we do knee-jerk responses and start permanently grouping children by standardized tests, which are a highly reductive event, or evaluating all the teachers or entire schools based on these things. Can you imagine evaluating all the doctors based on how many patients went in with elevated temperatures? This would be an awkward experience. So we really want to right-size it. Standardized tests are good for what they do. It only becomes a problem when we expect them to do things they weren't designed to do. So when we say assessment, we want to make sure we're focusing on assessment that is feedback to the learner. We want to think about assessment and evidence as the diagnosis and prescription relationship between the practitioner, the teacher, and the learner, the patient. And at all times, any assessment that we give, we want to make sure it's giving us high quality information so that the patient or the student can actually improve their health, their learning.